Mpox is a disease that causes a painful rash and other symptoms. This illness is a viral disease. It can make people very sick. Mpox is a global health concern. The virus can infect people of all ages. It is important to learn about Mpox and how to protect yourself. This essay will explain everything you need to know about this disease. We will discuss the virus, its symptoms, and ways to prevent its spread. Understanding Mpox is the first step in controlling its impact. Mpox is caused by a virus called the monkeypox virus. This virus belongs to a family of viruses called orthopox viruses. Orthopox viruses are known to cause diseases in both humans and animals. Smallpox, a deadly disease, is also caused by an orthopox virus. However, the monkeypox virus is different from the smallpox virus. Monkeypox is generally less severe than smallpox. The monkeypox virus infects human cells and disrupts the body's normal functions. It spreads through close contact with infected animals or humans. Understanding the virus and its behavior is crucial for developing effective prevention and treatment strategies. The monkeypox virus exists in two distinct forms called clades. These clades are named Clade 1 and Clade 2. Clade 1 is typically found in Central Africa, while Clade 2 is more common in West Africa. The two clades differ in their geographic distribution and severity. Clade 1 is generally associated with more severe disease. Clade 2 tends to cause milder illness. The current global outbreak of Mpox is primarily caused by Clade 2. This clade is considered less deadly than Clade 1. However, it is still important to take precautions to prevent the spread of both clades. Mpox spreads through close contact with an infected person or animal. This contact can be direct or indirect. Direct contact includes touching the rash, bodily fluids, or scabs of someone with Mpox. Indirect contact involves touching materials that have been contaminated with the virus. These materials can include clothing, bedding, or surfaces. The virus can also spread through respiratory droplets. These droplets are released when an infected person coughs or sneezes. However, transmission through respiratory droplets usually requires prolonged face-to-face contact. It's important to practice good hygiene and avoid close contact with infected individuals. Section 5. Recognizing the symptoms. Understanding the early signs of Mpox is crucial for timely intervention and treatment. Mpox typically begins with flu-like symptoms. These include fever, which can be quite high and persistent, headache, which can range from mild to severe, muscle aches that can affect various parts of the body, and a general sense of fatigue that can leave you feeling drained and exhausted. Swollen lymph nodes are another common symptom. These can be tender and painful, often appearing in the neck, armpits, or groin. This swelling helps distinguish Mpox from similar illnesses like chickenpox or measles, which do not typically cause lymph node swelling. After a few days, a rash develops. This rash is a hallmark of Mpox and is often the most recognizable symptom. The rash often starts on the face and spreads to other parts of the body, including the hands, feet, and trunk. It progresses through different stages, beginning as flat spots that become raised and filled with fluid. These fluid-filled bumps can be itchy and uncomfortable, eventually turning into pustules. The rash eventually scabs over and falls off, leaving the skin to heal. The entire illness typically lasts 2 to 4 weeks, during which time the patient may experience varying degrees of discomfort and symptoms. It's crucial to seek medical attention if you experience any of these symptoms. Early diagnosis and treatment can help manage the illness more effectively and prevent complications. Section 6. Diagnosing Mpox. In this section, we will explore the steps and methods used by healthcare professionals to accurately diagnose Mpox, ensuring timely and effective treatment. Diagnosing Mpox involves a combination of physical examination and laboratory testing. This dual approach helps in identifying the disease accurately and ruling out other potential conditions. Doctors will examine the rash, which is a key symptom of Mpox, and ask about the patient's symptoms and medical history. This initial assessment is crucial for understanding the patient's condition and determining the next steps. However, a laboratory test is necessary to confirm the diagnosis. Physical symptoms alone are not enough to definitively diagnose Mpox, as they can be similar to other illnesses. The preferred method for diagnosing Mpox is polymerase chain reaction, or PCR testing. This advanced technique allows for the precise detection of the virus's genetic material. This test detects the genetic material of the virus in a sample taken from a lesion. The sample is usually collected from the skin rash, which is then analyzed in a laboratory setting. It is a highly accurate and reliable method. PCR testing is considered the gold standard in diagnosing Mpox due to its high sensitivity and specificity. Early diagnosis is crucial for initiating appropriate treatment and preventing further spread. Timely identification of the disease can significantly improve patient outcomes and help in controlling outbreaks. If you suspect you may have Mpox, contact your healthcare provider immediately. Early consultation with a medical professional can lead to prompt testing and appropriate care, reducing the risk of complications and transmission to others. Section 7. Treatment and care. There is no specific treatment for Mpox. However, several measures can help manage the symptoms and support recovery. These measures include rest, fluids, and over-the-counter pain relievers. Vaccination can also be effective in preventing or reducing the severity of Mpox. The smallpox vaccine provides some protection against Mpox. Antiviral medications are also being investigated as potential treatments. Supportive care focuses on relieving symptoms and preventing complications. This may involve wound care, pain management, and treatment of secondary infections. Section 8. Mpox around the world. Mpox, also known as monkeypox, is a viral disease that has been a significant health concern in various parts of the world. Mpox is endemic to several countries in Central and West Africa. This means that the virus is constantly present in these regions, causing periodic outbreaks among the local population. Researchers and healthcare professionals in these areas are continuously working to understand the virus better and develop effective treatments and preventive measures. However, in recent years, outbreaks have been reported in other parts of the world. These outbreaks have been linked to international travel and the movement of people from endemic regions to other countries. In 2022, a large outbreak of Mpox occurred in multiple countries, primarily in Europe and North America. This outbreak was notable for its scale and the speed at which the virus spread across different continents. This outbreak raised global concern and highlighted the potential for the virus to spread beyond its endemic areas. It prompted international health organizations to issue warnings and guidelines to help control the spread of the virus. The outbreak was unusual due to its wide geographic reach and the occurrence of cases in individuals without travel history to endemic regions. This suggested that the virus could be transmitted through other means, such as close contact with infected individuals or contaminated materials. This highlighted the need for increased surveillance and preparedness. Health authorities around the world have since been working to improve their response strategies, enhance public awareness, and develop better diagnostic tools and vaccines to combat Mpox effectively. Section 9. Fighting stigma and discrimination. The Mpox outbreak has been accompanied by stigma and discrimination against certain groups. This stigma is often fueled by misinformation and fear. It is essential to combat stigma and ensure that accurate information is disseminated. Stigma can prevent individuals from seeking testing and treatment, hindering efforts to control the outbreak. It is crucial to approach the disease with empathy and understanding. Public health messaging should emphasize that anyone can contract Mpox. It is not limited to any specific group. It's important to treat all individuals with respect and dignity. Section 10. The global response to Mpox. Health organizations worldwide are working tirelessly to combat the Mpox outbreak. The World Health Organization, or WHO, is coordinating global efforts and providing guidance to countries. These efforts include surveillance, contact tracing, and case management. Public health campaigns are being implemented to raise awareness and promote preventive measures. International collaboration is crucial for sharing information, resources, and expertise. By working together, we can effectively control the outbreak and protect public health. Section 11. The importance of awareness. Mpox is a serious public health concern. However, by understanding the disease, its transmission, and prevention methods, we can effectively reduce its impact. It is crucial to stay informed about Mpox. Rely on credible sources of information such as health organizations and medical professionals. By working together and promoting awareness, we can protect ourselves and our communities from the spread of Mpox. Remember, knowledge is power when it comes to combating infectious diseases.